I didn't even realize that this stuff could be correlated. Is it normal for kids that have an eye turn to be uncoordinated and clumsy?
Good question.
Well, if you don't have good depth perception, then your visual system's not doing its job to direct you to move through space correctly. And two eyes working together is certainly necessary for good depth perception. And as you're learning to move through space between 3 to 4 to 5 years of age, that depth perception is very critical to understanding how far away you are from things, and certainly balance can be an issue that needs some attention in a lot of these cases, because kids with poor depth perception don't tend to move as much. They're not as sure about their space, so during therapy, we may have a child on a balance board or a trampoline and get them moving to see how well they feel in space when they're moving.
Jennifer, makes sense, doesn't it?
It makes a lot of sense. I'm really excited.
Well, this is enlightening, and we thank you so much for tuning in, and we thank Dr. Beasley for sharing all of this with us. So thank you, and good luck to you and your child up in Hickory.
Thank you, and thank you, Dr. Beasley, for the information. It was very informative.
Thank you. Thank you, Jennifer, for calling.
Once again, the number is 704-371-8895, or you can email me, jpopp, J-P as in Peter, O-P-P, at WTVI.org. Now, how long does treatment usually take once you have diagnosed a concern or a problem, and it's now time for little Johnny to be addressed?
Well, let me just take a case like Jennifer, her child,
Yes.
that's 7. I could take that for an example. When you have an eye turn, that's a pretty serious binocular
Let's make sure we
misalignment.
understand what that is.
What an eye turn?
Uh-huh.
An eye turn is when you have, when you're looking at someone, their eye may deviate and turn in or out, and it just looks like they're not looking at you with two eyes.
Okay.
Okay?
With just one eye? Is it with one eye or both eyes?
Usually, kids will prefer, they will pick one that becomes the leader and one that becomes the follower. And they may even alternate between which one is doing the work. So
Okay.
there's a lot of different varieties to it. And if you have that kind of a problem, then usually the treatment, when it's detected at an earlier age, and 7's still pretty early to detect that. We do have some children with an eye turn that are as young as 2 and 3 that we're doing therapy with. But even at 7, it's certainly not considered a late time to intervene, and a typical treatment session would last 45 minutes once a week with some home activities to direct that visual development. And it may last from 6 months to a year and a half, depending on how severe the problem may be.
If it's severe enough, is there a surgical procedure that could help this?
Sometimes when we get the visual system up and running, per se, get the software in the brain ready to accept 2 images, because when you have an eye turn, you have 2 choices. You can either deal with confusion like you saw from the double vision slide, or you can also have the brain will just selectively suppress and turn away the information from the eye that's turning in. So when you're suppressing, then you're basically receiving information only from one channel of the visual pathway.
Do I know that when this is happening to me?
No, you wouldn't be aware of it, because the suppression's actually an adaptation to get rid of that confusion and the double vision that you were experiencing before it would suppress.
Interesting. All right, let's go to the next set of slides if we can. Let's see what we have here. Developmental for an optometrist.
The optometrist that specializes in this type of area is either called a developmental optometrist or a functional optometrist. And we typically, and also behavioral, because we're looking at certain behaviors and certain functional aspects of vision. And there's typically training, post-doctorate training, and there's specialized organizations that get together. We have clinical seminars yearly.
Conferences?
Yes, annual conferences that look at the newest and updated versions of all the research that's going on in this area.
So what's that website? COVD.org.
COVD.org is the College of Optometrists and Vision Development, and that is the certification board of that particular association that certifies both therapists and doctors of optometry that want to specialize in this area. So that becomes a referral network so that if I have a child that's moving to Kansas, I would have a list and a website to go to find a doctor for them to continue their care there.
Okay, so we have a couple of websites there for you, and we're going to review those once again. How common are learning-related vision problems? And this is what this first slide here relates to.
Right. 1 out of 4 typically have some type of visual problem that could be significant enough to impair their academic performance. And if you have children that are in the learning disabled population, that number may be as high as 60%.
Wow.
Which have these kinds of things going on.
We're going to take a quick break. You're enjoying Healthwise right here on WTVI.
An educational grant is provided by All Ages Vision Care, specializing in learning-related vision care, including lazy eye, crossed eyes, tracking, neuro-optometric rehabilitation from head injuries, and cerebral palsy. All Ages Vision Care is located at 6917 Shannon Willow Road in Charlotte, North Carolina, and on the web at allagesvisioncare.com.
And by the Mecklenburg County Health Department, and by viewers like you. Thank you. If you would like support group information about tonight's topic or any Healthwise topic, call SupportWorks at 704-331-9500.
We're having a great discussion with Dr. Gina Beasley of All Ages Vision Care as we're exploring the critical link between vision and learning. Please join us at 704-371-8895 or writing to me, jpopp@wtvi.org. And let me just say that if you don't get an email in before the end of the show, because we only have 18 minutes left, you can email me during the week. I will forward any questions you have to Dr. Beasley, and she will respond to those questions. Or you could call the station during the week at 704-372, what is that number? 2442, 372-2442, and we'll be more than happy to address your questions during the week as well, since we air on the weekends. Great discussion on how important it is to make sure that your child has no visual problems going into learning.
Yes.
And when I said at the top of this show, do we take our eyes for granted? I can't help but think that perhaps we do until we realize there's a problem.
Well, I can give you a personal example of this, how things kind of develop. When I was young, I used to have a lot of chronic ear infections, which came along with a lot of antibiotics to treat those ear infections. And didn't have any hearing loss or anything, but by the time I was in high school, the visual process, it's like I would buy books and want to read them, but they would never get read. I would just never get around to getting into the story, and depending on how many pictures were on the page, I didn't like to read. And it didn't affect my basketball or my athletics because it was all out there, and I could do very well with the peripheral vision or the far vision. It was the reading vision that was affected for me.
So you had an impairment, but you didn't know it?
Yes, I had what's called convergence insufficiency, which is convergence is converging coming in. Insufficient means it wasn't converging enough to make it easy and clear. And I had double vision like we saw on that handout or the slide that I showed you. And I thought double vision was normal.
How about that? So until
and
when?
I thought everybody saw double when they read.
Until when?
Until I was 30.
You're kidding, Dr. Beasley.
No, my vision was not addressed in that way. I'd had several eye exams with optometrists and ophthalmologists before then because I'd get headaches on occasion, and I was smart enough to listen and see, when I was in the classroom that I could make really good grades even though I was seeing double when I would read.
What would you do? Close one eye?
Yeah, I would sit and close one eye like this, and it would get rid of the double.
And they think Gina just has a headache, or she's really into it. She's the thinker.
Yeah.
And you're closing one eye.
Yeah, and I would be very easily distracted if anything was going on. Oh, let's go do that, and I'll do this later. So I'd put things off and not finish my subject work whenever there was anything else going on. And, that showed up even when I was in college, and as the level of academics got harder and harder, it was harder and harder for me to do the visually demanding tasks that I needed to do.
So you were cheating the system, even though you weren't purposely there. I was talking with a dear friend this morning, and we were talking about your show, and she said she can remember when she was in school, she would do that test where you see, you give the visual test, and she would kind of like do this number. So, because she couldn't see out of this eye.
Right.
And it took a while for that to be detected. Here she
Right.
was cheating the system because
Right.
she didn't want to be embarrassed before her classmates.
Right. The school screening that you're talking about will ask you to occlude or cover one eye, and usually it's the same letter. So if you're smart enough, if it's OFLPB, then I'll say the same thing even though I can't see it with the other eye.
All right, symptoms. I mean, these are things to look out for, parents and grandparents, right? All
Yes.
right. Okay, we're going to get back to the slides in just a few seconds. But keep in mind, we have been talking about 2 websites. If you need to check out an optometrist in your area, and perhaps some of them may give a free screening, especially as early as, what did you say, 9 months?
6 to 9
months.
up to a year old.
And that's at infantc.org.
And it's not a screening, it's a full eye exam.
It's a full eye exam. So
Yes.
take advantage of that by going to infantssee.org. And then she also showed us on that slide covd.org.
Yes. How to find a doctor that specializes in this particular area.
Wow. Well, this has been very enlightening. All right. So when there is a learning difficulty due to a visual concern or problem, here we are talking about how long this may treat. But how do you know you've definitely diagnosed the right problem?
Well, a lot of the children that I see have already had they've had a psychological educational test, or they've already been treated by a learning specialist, and they're seeing that they may be, they may come to me with an attentional deficit disorder diagnosis, learning disabilities. They may be called a nonverbal learning disability.
Dyslexia.
Dyslexia is kind of like a big basket that holds a lot of different information. And a lot of dyslexia types of symptoms are visual-related symptoms. I don't treat dyslexia, but I do treat the learning-related visual information processing components that can look like a dyslexic.
So what you're saying here with the ADD or ADHD or learning disabilities is are you saying for the parents out there to make sure there's not a visual impairment,
Yes.
as opposed to being, okay, little Johnny may have ADHD?
Right. When we see children that have poor focus, poor attention, then we want to rule out these things that are very simple to rule out, but may take 6 to 9 months to treat. But once that's treated, then they don't have that symptom of attention deficit anymore, because now they've got the skill set they need to do the work they need to do.
So once again, what's the difference between a visual impairment and dyslexia?
A visual impairment is considered something that a visual impairment is more like I have decreased vision from a cataract, or I have decreased vision from a ocular health problem.
So it's really more of a health issue.
A functional visual problem is what we're talking about here, which has a functionality to it, but it's also very treatable. It's not like a disabled type of impairment that you're stuck with. You can actually develop the visual skills that aren't developed yet.
Okay, at any age?
At any age.
And is it better to have it treated earlier than later on, once the young person is in middle to high school? And here you were 30 and you still went through life.
So, if there's a critical age at 9, that didn't affect me, because, sometimes we tend to think that if you're older than 9 or 10, then it's too late to treat these types of problems. But really, I was 30 when mine was treated, and thank goodness it really saved me because now I really enjoy reading and,
Were you a doctor at that point?
I was in optometry school.
Wow.
Yeah.
Did you diagnose yourself?
No, I was diagnosed by a specialist that does this type of work.
My goodness,
And
what a
that
great
really-
story.
That really excited me to further be a service in this particular way because I went through and had the
You know
same
what it's like?
symptoms. Yes.
Let's go down to York. We have Luann with us. Hi, Luann. Welcome to the show.
Hi, thank you
Hi.
for having me.
And thanks for joining us. What's your question for Dr. Gina Beasley of All Ages Vision Care?
Well, I have an 8-year-old son, and the teachers have been telling me they're very frustrated with him because he acts out and he won't sit still. And the pediatrician has diagnosed him with ADHD. He's a very spirited boy, but I am hesitant to put him on any medication. He does like for me to read to him. He's very resistant anytime a book is placed in front of him, and I was just wondering what thoughts she had for me on that.
All right, and what are some of the symptoms to try to make him want to read if, in fact, if there's a visual impairment or if there's some function problem, he's not going to want to do that, right?
Luann, does your child, can she
She can hear
respond?
you,
Okay,
yeah.
good. Does your child like to color or do anything at near?
He'll attempt to color, but it's usually very scribbled, and it doesn't last very long at all.
So the visual attention for anything up close may be not very high. Is that correct?
Yes.
What
He
about
rubs
for
his eyes a lot,
Legos?
too.
What about for Legos or for puzzles or things like that? Does he pay attention for those things?
For a little bit longer, yes, but he likes the larger toys.
Right.
Nothing that really involves a lot of where he has to use his hands a lot.
Yes. Manipulatives are really a good way to help the visual system to work more correctly if there is a visual underlying problem. The actual hands are leading the visual system to do what the visual system should be by age 8 be able to do without the manipulatives. So you might try to have him hold his finger when he's trying to read because that will help settle the visual system to help him to know where to look also. But you may consider that maybe this is a visual developmental issue that needs addressing and get him tested so you can rule that out before you do any attention deficit medication.
Yeah, Leanne, I was going to add on to that if you're not comfortable with that diagnosis, let's make sure that you explore the options here after hearing what Dr. Gina Beasley has addressed.
It certainly is nice to know that there are other avenues to help him. I'm really not comfortable with any of the side effects that the medications may cause.
Leanne, we thank you so much for the call.
And if
Thank
you
you
Google,
very much.
Thank you, Luann. If you Google vision therapy or vision and learning, then you can find some websites and educate yourself on some of the other symptoms and behavioral things that could be correlated with what you're identifying here.
You could really sense that she is the parent that really wants to do the right thing for their child, and here she's been given the diagnosis of ADHD with medication.
Yes. Attention deficit is diagnosed with a behavioral checklist. There is no blood test. There's no MRI scan. It's just, does your child sit and pay attention? Does your child stay on track? And, if I go to a football game, I may be diagnosed with attention deficit because I'd rather be watching what other people are wearing and how they're, things that because maybe I don't understand the game as well as people that are very attentive to it. So attention deficit to a particular activity or group of activities could be that you don't have the skill set in order to pay attention to that.
Interesting. All right, I want to get back to your visual functioning. Can I call it a problem?
Well, it was.
An
but
issue?
It was, but it's not anymore because it was treated.
I know, but look, I'm reading a quote, and her website addresses where you can go to the North Carolina Sports Hall of Fame, and Billy Packer said of Gina Beasley, quote, any guy in the ACC would love to have the shooting form of Gina Beasley. How in the heck could you shoot a basketball and have the vision concern that you had?
Well, when I was in high school and when I was in college. I didn't wear glasses. I had 20/20 eyesight in both eyes. And most of my shooting was beyond arm's length, obviously. So it was distance.
And it wasn't the double vision at distance?
No, it was just up here. Oh. My vision far away was fine, but when my eyes would turn to come in here, one eye would drift out on occasion.
So when Coach Yao had you instructing and you're doing the X and O's and you're going through the classroom instruction, how did you pay attention and comprehend all that?
Most of it was on a chalkboard that was 10 feet away.
So once again, it was distance.
Yeah.
But if you had a playbook or had something to read, that was...
If we had a playbook, I would sit it back, further away maybe than what would be typically the right distance for me, just because it was easier. Didn't put as much stress on the system.
All right. What are some other tips that you can give to parents out there, what they should be looking out for their young people?
To use their intuition, because just like Luann was saying, it didn't feel right, or she wasn't comfortable with the diagnosis. Keep searching. A lot of times, unfortunately, vision therapy is considered the best known secret in optometry and in visual health, because it's not the first thing that comes to mind, because the vision and eyesight are confused oftentimes, and we do an eye check for eye acuity and we think vision's okay.
I'm glad you brought that up, and let's touch on that a little bit more. So here you take your child in, and how soon should a child have an eye test to make sure that they see clearly?
You can do an eye exam on an infant.
Okay.
If you have that special training. But if you're certainly by age 5 to 6.
But what we're talking
school.
about now is, in addition to having that test, make sure that you have the test that the child has no functioning issues. That's different from a regular eye exam. Is that what you're saying?
That's correct. If you have a family eye doctor, a family optometrist, that is certainly a good place to start, because they can help rule out the eyesight, the eye health, and they do some eye tracking and eye teaming test for depth perception, so that if there is an eye that's weaker than the other, that can be easily detected and treated. I have a lot of referrals from our local optometrist here in Charlotte area who do a great job with the routine eye assessment. And if they see a problem that they know we can help them with, then they will refer to us as a specialty group to do that service for the patient and the family.
All right. I think we have one more slide? Let's see if we have any more slides to go to. Our time is quickly escaping. Efficiency skills.
The visual efficiency skills, again, ocular motor skills to track a line of print.
Whoops, the slides went away again.
Okay.
So can you we had several slides to address with efficiency and a couple more headlines.
Right.
Let's go through theirs. We just have 2 minutes to go.
Wow.
Yeah.
It's gone by really fast.
It has. You got to come back. So efficiency.
That'd be awesome.
Efficiency skills.
Visual efficiency skills, think of it as how we take in information. So tracking, focusing, and eye teaming. Visual information processing skills are what we understand of what has come in. And the eye-hand component has to do with what we've understood and how do we get it back out to communicate with other people, what we understand and perceive.
It is so interesting. And in speaking with my friend this morning, this is on the flip side. Here, an Alzheimer's patient apparently went into the unit, and it ended up they had a visual concern, and it was not detected, thinking that it was someone who had more of a memory issue here.
Okay.
So once again, it goes back to what we were saying earlier. Don't take the vision for granted. If there's a concern or a problem, get checked for your vision. Is that one of the messages I'm hearing you say?
Yes. The having peace of mind to know that all these things work well, and to know that there's help at any age for a lot of these problems. I have a young man who's in his 50s now, who is a 911 operator and has had a lazy eye all of his life, and has started having a lot of severe headaches. And wanted to come in for some help to help that eye that's not working too well to see better. He started out around 2400 and he's already down to 2070 in the eye that was considered almost a blind eye.
Wow.
And he's 50.
And it's never too late.
No.
That's a perfect example of that.
Yes.
Here you were 30
Yeah.
and you were diagnosed and you were able to get corrected with the double vision.
Yes.
Interesting. We had some callers, but unfortunately our time's gone. So I'm going to ask if you could just give your questions to our phone bank or call us back during the week, and we will certainly get these questions to Dr. Beasley. Once again, you can email me, jpop@wtvi.org. Dr. Gina Beasley of All Ages Vision Care. You're down off, what did you say, Highway 51?
Highway 51 and Carmel Road.
Thank you so much. You got to come back.
Thank you. I'd love to. I'd love to.
As always, we hope that this medical broadcast has helped you become more health-wise. Once again, join us throughout the season. We have some great topics coming up, and you can email us and call us once again, and we will get this information to Dr. Beasley. Thank you. I'm Joey Popp. Whatever you do, make it a great week.
If you would like support group information about tonight's topic or any Healthwise topic, call SupportWorks at 704-331-9500. If you have a comment or question about Healthwise, call 704-371-8836 or email us at healthwise@wtvi.org or go to the website wtvi.org. If you are interested in being a guest on Healthwise or like to sponsor a Healthwise program, please call Suzanne Milkey at 704-372-2442. Learn more about Healthwise and other local productions at wtvi.org. Go to our website and you will see current and upcoming events on air and in the community. That and much more at wtvi.org.